Good morning, everyone. It's interesting to me how COVID-19 is being used as an excuse to spend money outside of Canada, and there's lots of money that's been spent outside of Canada from our COVID-19 unending bank account of credit. Because it's not money that we've got, it's credit that we've got. So we're borrowing to do this. We're borrowing to give this money. Okay, and I'll give some context for this money too. Omar says, sorry. Today, Karina Gould announced that Canada will extend support to the UNRWA by $90 million to help Palestinians with healthcare and education needs. Aw, isn't that great? Susie says UNRWA funding was halted by several European nations when it was revealed that much of the money was being used to fund anti-Semitic programs in Palestinian schools and even to bolster bank accounts of Hamas leadership. Israel should kick out the Canadian ambassador to Israel. That's in response to that. And I wonder who decided to stop funding the UNRWA, and that would be the United States, Switzerland, and a few other places. I'll show you that in just a second. But in my search for finding that, these are all the Google, and I was looking at Google funding cut was my first Google search, and then I kind of refined it and played with the words a little bit. And this one revealed. The UN Agency for Palestinian Refugees runs out of money. That was November 10th, 2020. The UNRWA on December 9th has run out of money. That's December 9th, 2020. Don't worry. Canadians are going to send you $90 million. $90 million, you know, and everybody's spinning this as helping those poor in-need Palestinians. Not true. Not true. Here's a 2018 article. U.S. ends aid to Palestinian refugees. That's why they ran out of money, because the U.S. stopped giving them unending money because of the corruption, right? Here's Switzerland and Netherlands suspended the UNRWA funding, undermining Palestinian refugees' rights. Now, I want to give you the slant of this article, but this gives context as to why not just the United States did it. Because if it was just the United States, you could spin it like, oh, that evil Trump, he doesn't like refugees or something to that effect, right? Not true, again, but regardless, they do that anyway, regardless of the truth. And regardless of the corruption, here we go. The Euro-Mediterranean Human Rights Today criticized Switzerland and the Netherlands' decision to suspend their support for the United Nations Relief and Works Agency for Palestinian Refugees in the Near East, UNRWA. The decision came after the leaking of a report on the corruption in the UN organization. Those most likely to lose out are hundreds of thousands of displaced Palestinian refugees, the Euromed said. Okay, this is like holding the refugees hostage. Listen, you're giving me money, and sure, I may line my pockets, but I give these guys the crumbs and the crusts of what I don't eat. And so, if you dare harm me, the real person here who's going to hurt is them, because I invested all that money. So I'm still making money. I just like more of it, and I'm not going to give them anything. So the only people that get hurt are them. Do you really want to hurt them? Right? Like, this is crazy. We're allowing, first of all, we're paying for this. Second of all, we're allowing them to hold these refugees, these poor defenseless refugees, hostage? Okay, sure. I guess we'll just give you money then. Haha. Oh, Canada. Right? Like, honestly, I've got a little flag here. I could, right? Right? Like, honestly, we are in a situation where they're just misusing our tax dollars to send it out to corrupt agencies. The article goes on. Corruption should not be addressed by cutting off funding, but by strengthening transparency mechanisms, mentoring, or even direct supervision, stated Euromed Monitor. Moreover, those who oversee the operations of the UNRWA are mostly members of the European Union. So the corruption is in the European Union, guys. It's not here, it's there. They're the ones who are getting fat off the hog here, off this pork, extra pork spending. And they're the ones who are in a situation who don't want to give their excess to those poor refugees, right? And corruption shouldn't be addressed. We should just directly supervise, right? We should just, yeah, they're gonna let that happen. Sure. Can we go to the mall now? No? Yeah, they're not going to let anybody directly supervise their corruption. Okay, just like we're not going to be let out of our houses. We're just going to have to do it. Okay, Ahmed Hassan. This is before we get to the real big story today, because the big story is the shutdowns, right? The lockdowns. Right on schedule for that leaked document in October. Thank you, anonymous parliamentarian who leaked it. Do you want to come on my show? You can be anonymous. I won't out you. But my goodness, I'm interested. Okay, anyway, Ahmed Hassan says, one Canadian experiencing homelessness is one too many. This year we launched the Rapid Housing Initiatives to build thousands of homes across the country and help Canada move closer to our goal of finally eliminating chronic homelessness. That's a lofty goal, one that doesn't consider that homelessness is a product of multiple other situations. Like oftentimes there are other problems that are affecting somebody who has ended up homeless, not just the lack of a home, right? There are other issues. There are mental health issues. There are behavioral issues, alcoholism, addictions, all sorts of other issues that go along with being homeless. So giving them a home doesn't solve their problem. I'm sorry. Like it's like it. There's a lot of analogies, but I'm not quick enough this morning to come up with one. But it is solving one problem while ignoring 10 others, right? And the 10 others impact the problem that you've solved, right? Like it's just problematic. The problem with this though is here's somebody from Pakistan. He says, "Hello, sir. Mu passport is ready." I don't know if he misspelled my or if mu is how you say my in the language there. You know, I mean, Canada's reputation is just sterling on the world stage. Okay, let's get into the restrictions. Restrictions on travel. This is a meme that I thought we were going to start the show with, but I thought I wanted to show you that they're using COVID-19 to steal money, to send it to organizations that they already know are corrupt. This is happening, okay? This is happening too. Restrictions on travel, ending free speech, banning protests, silencing opposition, prohibiting visiting family, immunity passports, closing businesses, starting quarantine camps, forcing vaccines. Those who still don't see what this is are very blind. Read a history book. I'm very concerned. I'm very concerned. So here is, oh, this is annoying. This is a tweet stream from yesterday when the news was breaking. This is all based on models. Cases and models, cases from a flawed PCR test, a PCR test that the WHO knows the cycle testing are too high and Ontario cycles too high. We cycle to 40. So the cases mean literally nothing. Literally nothing. Anyway, this is the tweet stream. We're going to get into the news of this. I wanted you to have access to the graphs. I thought this graph was really interesting. Like, yes, it looks like things are really getting out of control here. This is November. This is December, right? Like the real December here. Where's the real December? Which date are we? 2022? 1921? Yeah, we're here. Yeah, it really looks like it's taken off. There's no justification for this whatsoever. There's no justification. What is happening is absolutely criminal, absolutely unbelievable. Doug Ford says, we saw this morning's modeling that our COVID-19 numbers are accelerating at an alarming rate. We've seen a 70% increase in hospitalizations and an 80% increase in ICU admissions in the past few weeks. If we fail to take action now, the consequences could be catastrophic. There are people who are very upset with him. I am one of the people who's very upset with him. All of his tweets are heavily ratioed. This is a huge ratio. And I've seen other worse ones. Like every single one is ratioed. And right away, like there's 10 people commenting, calling him an idiot. Basically, he's alienated his base. He's alienated small businesses. One of the main campaign promises that he said was Ontario will be open for business when I take over. And he's literally unilaterally shutting businesses for fantasy, for cases. Nothing. The all-cause mortality is completely normal. Where did heart disease and, hold on, sorry. I've improved my all-cause mortality as I get more information. Here's the updated all-cause mortality page. And you can see that it's got the years broken out here and the total numbers instead of the breakdown by each cause of death, right? Cancer, heart disease, diabetes, etc. But if you click on it, it'll take you to that page, and I got to fix it so it opens in a new tab. But anyway, it'll take you to the page that I got the source from. And this is an interesting note. Okay, so in the month of July, if you look at usually cancer, this is heart disease, this is lung disease here, lower respiratory disease. These are the numbers in January, right? 130 cancer, February 125 cancer. But if you go down to July, 55 died of cancer. If you go to August, 0 died of cancer. In August, 0, no cancer deaths. If you go to September, no cancer deaths. And this is Newfoundland. It's not as blatant, right? But the same thing all across the Atlantic provinces, right? Here's Nova Scotia. 0 cancer deaths in September or August. 0 diseases of the heart killed anybody in September, August. 25 only in July. The numbers are drastically reduced halfway through the summer. And then from the highs in January and February of this year, and even through the beginning of the pandemic, where the numbers were relatively high. Where did these deaths go? Right, COVID's up. Right, that's interesting. Oh, COVID's 0 in Nova Scotia. COVID's 0, so that's interesting too. Where is that data? Why aren't they giving us the data? Is it 0 or is the data just not there? I don't know. I'm not sure. Right, but very interesting. Same in New Brunswick. Right. So very interesting. New Brunswick's got 0 for COVID ever. Quebec, COVID for 30. And not to go through, it's kind of like baseball statistics, but there's a difference between the January numbers in Ontario and the July numbers, September, August numbers. Same across all the provinces. So I don't know if the data set is incomplete or what. It's very interesting. I want to show you the cases in Guelph as well. Everybody's in this lockdown now. 10 cases in the hospital. 152 active cases, 10 cases in the hospital. Is that a crisis? Is that an emergency? At what point? Why does that make it an emergency? What criteria are we looking for an emergency? The context as well. September, we're so busy. September 23rd, we're laying off 97 registered nurses amid pandemic. Financial challenge, that's why. Ontario's official opposition party says it doesn't understand how nearly 100 frontline workers at a GTA hospital have been laid off in the middle of the pandemic. On Tuesday, South Lake Regional Health Centre in Newmarket, Ontario confirmed it will be laying off 97 registered nurses as a result of a significant financial challenge. Similar to some other hospitals across the province, South Lake is currently facing a significant financial challenge and has announced a series of changes to address this while maintaining the same high quality care that we provide to the community we serve. So how did that happen, right? How did that happen? The nurses union, representing more than 68,000 nurses and healthcare professionals, said that the loss of these healthcare workers amounts to about 176,000 hours worth of direct patient care. You know the best time to cut healthcare workers during a pandemic, right? Here's what's open and closed. I'll get to this in a minute. Randall Delaney says, Doug Ford's nonsensical Ontario-wide lockdown is his dumbest move yet. Yeah, but what's open and closed? I thought I'll just highlight a few things that are closed. Drive-in or drive-through events are prohibited. Why? Concert venues, theaters, and cinemas may only open for rehearsals performing a recorded broadcast. I mean, like the drive-through events, it's not like you're all getting in a bus and like going communally through this drive-through event. Like you're in your car with your family. So you're not allowed to drive through something? You're not allowed to go to a drive-through thing? Because you might stop at a drive-through restaurant on the way home? There is no logic to this. This is insanity. This is arbitrary torture. And I do mean torture. Go watch Amazing Polly's video on it. It's unbelievable. And the more we allow them to do to us, the more they will do. Your livelihood, your business is going bankrupt. You're missing the most busy time of year. How is this allowed? How is this okay? This is absolutely not okay. The numbers don't bear it out. The numbers don't bear it out. 10 people in the hospital. These kind of death numbers, these kind of all-cause mortality numbers. Here's the age of people dying. Okay, the purple is above 85. The green is 65 to 84. The red is 45 to 64, and the blue is 0 to 44. I know what blue, right? And this chart is in the thousands. So, my goodness. Here's U.S. total deaths in the U.S. and they've got sources for their data, CDC, 2,712,000 in 2015. 2020, 2,818,000, right? In 2019, 2,855,000. 2018, 2,839,000. These are more than 2020, right? That's more people died in the previous years. Same in the United Kingdom. This is expressed as based on deaths per thousand of population. So I just when they say there's nothing else we can do, We've had months and months to get ready, and we're laying off nurses, and there's nothing else we can do but cancel drive-in events because for your safety. We have to close all indoor and outdoor sports and recreational facilities because that's for your safety, right? Because we're gonna keep you safe by making sure that you can't go to the gym and work things out. We're gonna close ski hills to make sure you can't get outside and exercise because that's not safe. You can't go outside anymore. Well, I mean, I guess people are being arrested for playing hockey in Canada. So welcome to the communist overlords because for your safety, comrade, right? Like, honestly, locker rooms, change rooms, and showers at clubhouses are closed. Let's scroll down again. Supermarkets, convenience stores. This is the other part. We're asking people to stand outside and wait in line. This is the most stupid. Why are people not saying this is stupid? Why are people allowing their local representatives to say, okay, well, I guess that the province says so we got to do it, guys. We can flatten the curve. Frickin' morons. Like, it is the most ridiculous, maddening thing because these people are obviously wrong. And I don't know if people are too scared to tell them that they're wrong or if they're too brainwashed to see that what they're saying and selling in the media is complete bullshit. I don't know what it's going to take, but holy crap. Holy crap. We're at Christmas, and our Christmas present from the government is you lost all your rights. You don't get to worship. You don't get to celebrate with your family. You get to be locked in your house for the crime of being a person in Canada who celebrates Christmas. Those Easter worshipers, eh? Okay. You have to stand in line. Doesn't make any sense. Supermarkets, convenience stores, and indoor farmers markets are open for in-person shopping at 50% capacity. Pharmacies I would just call myself an indoor farmers market. We're a flea market. You want to shut us down? It's a flea market. It's open. Pharmacies are open with 50% capacity. Discount and big box retailers who sell groceries to the public with 25% capacity in a room. Safety supply stores or businesses that sell, rent, or repair mobility. Blah 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 blah. Liquor stores. The pot stores are no longer exempt. You have to pick up. I think you have to pick up from like you do curbside pickup or delivery or whatever. Again, this is destruction of our, like, they have to pay so much money to get their storefronts. Ontario paid, it was such a botched rollout, and now they can't even use the stores. It's disgusting, the stupidity at the level that we're talking about. It is disgusting. Why don't we just give Palestinian refugees more money? I think that's a good idea. Anybody Google it? Oh, okay. Frustrating. It's frustrating. It's frustrating. All construction activities and services will be allowed to continue. Weddings and funerals and other religious services are limited to 10 people indoors and 10 people outdoors. Virtual and drive-in services, rites and ceremonies are permitted. At least they're not banning that yet. Wait till the next lockdown because, we just didn't do it right over Christmas. It's all your fault, citizen. This is the National Post article. Randall Delaney, Doug Ford's nonsensical Ontario-wide lockdown is his dumbest move yet. Yeah, I agree. Ontario's Premier Doug Ford made the dumbest move of his premiership Monday. His severe pandemic lockdown of the entire province will not only subject millions of Ontarians to unnecessary restrictions, it effectively undermines the idea that his government's decision-making is driven by science, logic, or even a minimum of rationality. There's a significant COVID problem in Toronto, the GTA, and Windsor-Essex. I'm not sure that there is. There's a significant government problem in all of those places, that's for sure. Back to this. There's a significant health professional, the health officials who are making these calls. There's a significant those people problem in those regions, certainly. There's a significant PCR testing problem because nobody in positions of power have acknowledged the fact that the PCR tests are flawed according to the WHO. Nobody in Ontario or federal governments have acknowledged that the WHO doesn't recommend lockdowns. Frustrating, right? Frustrating. Anyway, if you want to believe what this person says, there's a significant COVID problem in Toronto and the GTA and Windsor-Essex. That's not going to be helped one bit by shutting down everyday life in Ottawa, Northern Ontario, and areas where COVID numbers are light, like 10 in the hospital. In his media conference, Ford tried to portray the lockdown as protecting the low COVID areas from hordes of invading sick people. He specifically cited Ottawa, a city of 1 million people that has only 19 COVID cases in the hospital, none in intensive care, and just 378 active cases. Apparently, the city faces the hitherto unperceived threat of droves of Quebecers surging across the border to infect the populace. Either those droves are facing a long drive, or they will come from Gatineau, the neighboring Quebec municipality, which has 28 COVID cases in the hospital hospital, 0 in intensive care, and a total of 404 active cases. Ford asserted that health officials are telling him that people from high caseload areas are spreading the virus to other areas. Maybe so, but those health officials didn't offer any proof of that in their own briefing, and the numbers would suggest that it's not significant. Even if Ford's fears for Ottawa are correct, there's a far simpler solution: close the bridges to Quebec. Quebecers closed their side earlier this year, so they could hardly complain. The Ottawa reasoning was just one example of a rich buffet of irrationality Ford had on offer. Schools are not part of the problem, the Premier stated, but he's closing them for weeks anyway. He repeatedly told Ontarians that they could be on the brink of a catastrophic situation. Bullshit. The catastrophic never situation has never materialized. Never. Back to this. Why? Just look at what's happening to the William Ulster Health System, which runs hospitals in Brampton and Etobicoke. Ford brought hospital CEO Dr. Naveed Mohammed to talk about how bad it was. So get him some sleep. Don't shut down the entire province over it. Yeah, he looked awful. He looked awful. Here he is. I thought somebody had docked, like I saw this picture here. No, this next one maybe? Yeah, this one. And I thought somebody had doctored it. I thought somebody had like made a meme that like they were being mean. Nope. He just looks like that. I don't think that this is because you're. If you look like this because of this, the hospital is not very well managed in my opinion. Really. And maybe I don't run hospitals, so maybe things are more busy than I think. But goodness me, maybe get him an assistant. Like. Anyway, Ford and his team asserted that the province's surgical backlog is now such a problem that the lockdown is necessary to maintain surgical capacity. Ontario's healthcare system sat on its hands all summer while COVID case numbers were low, failing to seize the opportunity to reduce the surgical backlog. It didn't seem to bother the government back then. The question of hospital capacity is fundamental to justifying the lockdown, and yet the government boasts it created 3,100 new hospital beds to help with the pandemic. Now we're told that the whole hospital system starts to melt down when 300 intensive care beds are dedicated to COVID patients. Something doesn't add up. Nope. In their earlier briefing, Ford's health experts spoke lovingly of the lockdown measures imposed in France and the Australian state of Victoria. Both invoked curfews and severe restrictions on all personal movement. You can still walk a dog in France, but don't go more than a kilometer from your home. These types of restrictions border on mass house arrest. We're already there. But Ontario's experts like them because they do bring COVID numbers down. Quelle surprise. I want to mention, Australia is coming out of their flu season right now. Australia is in their springtime and coming into their summer. So their numbers coming down has nothing to do with the lockdowns that were imposed. It has everything to do with the seasonality of this. This is the flu. Honestly, back to this. Those severe restrictions are effective in the same sense that amputation below the knee is a surefire cure for a sprained ankle. Nevertheless, provincial health experts are going to get their lockdown, and from what they said Monday, the longer the better. 4 weeks would make them happy, 6 weeks ecstatic. None of these figures and assertions presented Monday capture the greatest harm done by Ford's 180-degree turn on COVID policy. In early November, his government laid out 5 levels of health protecting restrictions and offered clear and valid thresholds for moving from one level to another. It wasn't just another government document, it was a deal with people and businesses. They were told the rules of the game. Now the Premier has just discarded those rules and replaced them with anecdotes from the worst hit hospitals and advice from the most passionate lockdown enthusiasts. Ford could have imposed more severe restrictions in the most affected areas, creating a maximum benefit for the minimum harm while staying consistent with the approach that he has taken for months, balancing health and economic concerns. Instead, he's telling people in areas where COVID numbers are low to lock down like Armageddon is at hand. Imposing stupid rules encourages people to ignore government rules, including the ones that are necessary. That would be a big problem. Now, earlier in this, and I should have kind of gone off on a branch when they mentioned it, but he talked about hospital capacities and the 3,100 new hospital beds to help with the pandemic, and 300 beds is when we start to melt down. And that schools aren't going to be closed. Here's what's happening with schools. Basically, you're supposed to send your kid to online learning from January 4th to January 8th, the first days of school back after the holiday. I've said this yesterday, I think. There's never been an experiment on online learning. There's never been a mass experiment on K-6 online learning. There's never been a good study or a good even what are the expected outcomes? What are the comparisons drawn? There's never been anything. There's never been anything at all that I've seen looking at the positive and negative impacts of doing mass online learning, having children being a part of online classrooms, etc., etc., etc. Never seen anything like that. Not by the Canadian government, not by the US government. And I worked in education for 15 years. In fact, the last time I worked in education was 2015. So up to 2015, I never saw anything about online classrooms being studied en masse at all, but the impact on the well-being of the children, the impact on the education value of the children, the education value of the lessons, excuse me. Now, I think videos are very powerful. I think that you could utilize them, but I don't think that putting a teacher in front of a Zoom camera all day is a good idea. And that's what they're doing. And so they've never done comparisons. They've never done, is a teacher with a Zoom camera good, or is a YouTube video covering a lesson better, et cetera, et cetera, et cetera, et cetera. They don't know. And because they don't know, it is inappropriate for them to experiment on my children. So they can take their January 4th to 8th online learning and shove it. And as soon as they return to regular in-school classroom instruction, I'll be happy to return my child to it. Now, to be honest, and I said this to my wife as well, I don't like the critical race theory, and I've made this clear with the Upper Grand District School Board too. I don't like the critical race theory. I don't like the social training that they're doing. I think it's bunk. I think that they should be training kids on reading, writing, and arithmetic, and leaving the morality training to the parents, because it's not appropriate. But my goodness, I mean, you can't even get them to stop being racist against specific children because of the color of their skin. So how can you possibly bridge such a complex topic, right? I mean, and some people would say, keep your kids home and school them at home. Sometimes homeschooling doesn't give everything that you need, and I don't want to get off on a tangent here. I'm already kind of off on a tangent. Sometimes homeschooling doesn't give everything you need with regards to social interaction, right? Like having kids' autonomy and having friendships outside of the familial base is good. It's positive, and maybe that positive outweighs the brainwashing. I don't know, but I don't know. We'll see, I guess, right? We all have to make that call for ourselves. So we'll see how things work out. I'm hopeful that I can balance things. We'll see. Anyway, regardless, the hospitals in southwestern Ontario, and here's the Dr. Naveed Mohammed. This is his remarks, and he's talking about how Doug Ford says we can't keep delaying life-saving surgeries because of COVID-19, but the hospitals were actually full anyway. Some of Ontario's biggest hospitals, this is from January 22nd, 2020, some of Ontario's biggest hospitals are filled beyond capacity nearly every day, new data reveals. Some of Ontario's biggest hospitals, same one. Most Montreal ERs report overcrowding. The Jewish is at 150% capacity. It's even worse in the South Shore, where the Valleyfield Hospital leads the pack by reporting it's at 259% capacity. So we have a giant pandemic, and they throw $63 billion, and that was Quebec, but they throw $63 billion at the healthcare system, and we're laying off nurses, and we can't have more than 300 patients in the ICU without locking the entire province down. How does this make any kind of sense? This is complete incompetence. Here's another one, hospital over capacity again in 2018-19. Shortage of long-term care beds, a major factor. Oh my goodness. You know how you could free up some long-term care beds? Hey, Doug Ford? Ever ask anybody about that? Right? It's unbelievable. Mismanagement. Ontario has 500 hospitals, have 915 COVID patients. Doug brings out the CEO of Ulster to support lockdowns because Ulster has 147 of the 915. Why not allocate away from Ulster to the 499 hospitals with less than 2 per hospital? Capacity is fine. This is mismanagement. Status of cases, status of deaths. I've shown you all that. Brampton City Council declares healthcare emergency, calls for more funding. This was January 22nd, 2020. This is the day before I think that Donald Trump was briefed on it. In fact, I think I was talking about January, just around this time. I think this was kind of made public that there was something maybe happening, and nobody would talk about it. Everybody was saying it's racist to say Wuhan flu, right? Wuhan flu is racist. COVID-19, whatever. Here's Catherine McKenna, and she's sharing a statement from the Ottawa Public Health. And the quote is, I'm disappointed with the decision by the provincial governments to apply a 28-day shutdown on the city of Ottawa, and I've asked the provincial governor to reconsider a 2-week shutdown for Ottawa, one that would be as short as possible in consideration of the evidence, Dr. Etchins. And here's the statement. This bothered me. I thought this was weird. Who says quay? Anybody say quay? Anybody walk into a room and they say quay all the time? Is this a lot of people in Ottawa doing this? Yeah, no. Is this maybe a band that I'm not aware of? Things like this. It's unnecessary virtue signaling. It's like putting your pronouns in your Twitter handle, or wearing a mask in your Twitter handle or in your profile picture. Like, these things are just unnecessary little bits of 2020 that just like planking. You just didn't need to do that. Like the whole thing was stupid. Everybody should feel bad. Move on. Like, okay. Over the weekend, I connected with Dr. Williams, Ontario's Chief Medical Health Officer, about the shutdown, which was announced earlier this afternoon. I want to acknowledge the dire situation most of our province is facing and how important the next weeks will be to stem the tide of COVID transmission across Ontario before it leads to unprecedented hospitalizations and cripples our healthcare system. There's only so many times you can cry wolf before people stop believing you. And we've all run out to the barn or to the animal pasture a bunch of times with our pitchforks and guns ready to get the wolf, right? Or more appropriately, we've all run into our houses and locked the doors and put on our masks with our pitchforks and guns to keep out that pesky virus, right? And now they're like, oh man, it could happen for real. And now it's mutated. It could really happen, guys, for real. It's just in another couple of weeks. This is the most important couple of weeks. Yeah, sure is. And you've destroyed small business. And she's advocating for a less lengthy lockdown, but she's still advocating for a lockdown. Anyway, she says, I highlighted the incredibly hard work and significant sacrifices Ottawa residents and businesses have made over the last several months to keep COVID transmissions down. If she cared, I would say maybe she could bring up the PCR testing. I would say maybe she could bring up the WHO's recommendation about not having lockdowns and how lockdowns should be a last resort. And we're certainly not a last resort, certainly not across Ontario. The negative impact of lockdowns. But see, if she opens that can of worms, then everybody can talk about it, right? Until now, people aren't talking about that in Canada, right? And there's resistance to talk about all that stuff. Asymptomatic spread. Oh man, can't talk about that. That's real as the wolf is getting our sheep, right? It's there. It's just in 2 weeks. Do you see it just over the horizon there? It's coming, and it's going to sneak in when you're sleeping. The wolf. It's going to get them. The sheep. They're just lying. Just had a message from my dad that his business will likely not survive another forced closure, says Jenny Wood. In an area with minimal cases, thanks Ford Nation for being the death of small businesses. I said yesterday, it's awful going into Christmas knowing that your business and your restaurant and everything you've worked for, maybe your family's life savings, maybe your retirement, maybe you were hoping to sell your business and all of that stuff, it's gone. It's gone, right? Like it's not like it's gone because of things that were out of the government's control. It's gone because the government will send riot police and mounted officers to shut down your barbecue if you dare to defy what they're telling you to do. You understand? It's not because people will get sick and they'll die. It's not because people will not come to your business because they're afraid. That's clearly not true. It's not because the people who come to your business will kill other people because there's a 10 million person study in Wuhan, China that says healthy people don't spread this disease. 10 million people, they tested all the close contacts of the positive asymptomatic cases. Do you know how many situations where there was another sick person? None, not one time. And that means that transmission from sick people or from healthy people doesn't happen. So we're in a situation where the government has ignored valuable, not to mention the cures, the treatments. Donald Trump got COVID-19. He survived. He's fine. There's a bunch of people who have gotten COVID-19. The biggest thing that they had to do, isolate because of the government rules. This is a government self-made disaster. We did this to ourselves, and we're continuing to do this to ourselves by refusing to demand that the people in charge look at the real data, look at the numbers, look at what's actually happening. We're doing this to ourselves. So that compounds this disaster by much more, because, all that stuff that people worked for is just gone. Like, it's not just a gone year, right? Like Walmart says, Walmart says we made tons of money last year. Let's keep doing that. But if you've got a small business, right, maybe you can survive one down year, but a down year isn't a year where you just get bills. Like, you can't survive a year where you just have to pay your employees and your rent. You can't do that. It doesn't work like that. If your employees and your rent cost $10,000 and your business made $11,000, right? Let's say last year, then, you've got a much smaller, robust business than you may have had previously. And you can't survive. It doesn't make sense to do that because it's not worth your time then, right? So this is the destruction of small business in a very insidious way. It's for your safety. And you don't realize that it's happening because if you work for the schools, you get paid whether you're in school or not. It doesn't matter to you. If you work for the government, paid whether you work or not. Doesn't matter to you. And that's 50% maybe. If you do the schools, the unions, the government workers, the provincial and federal government workers, all of those people, if you add all those people up, you've got a lot of people who are on the government dole, right? On the government salary, excuse me, not dole. So all those people are kind of, they don't care. They don't A, understand what business is, and B, they don't understand the impact of the long shutdowns. And because of all of that, because of the people are misinformed and because the news won't tell you, the businesses are being destroyed, completely destroyed. Here's the PCR testing. So the PCR test cycles used in Canada, in the Canadian labs by province, and on Ontario, it's 38 to 45. I thought it was only to 40. I haven't seen 45, but 45 was on the scale. Regardless, this is an in-depth look at the PCR tests and the validity of them. Basically, anything upward of this demonstrates that as the COVID-19 pandemic ebbed in severity by mid to late May through early June, the CTs, the cycle thresholds, the times they cycle it through, anything above 25 is basically a false positive 50% of the time, and it's a higher false positive rate the higher up you go, right? To a point where it's 97% at 37 cycles, it's 97% a false positive. There's very little chance that it's a real positive, according to the reading that I've done anyway. So by mid to late June, or mid to late May through early June, the CTs drifted upwards into 32 or non-infectious range. This upward drift, furthermore, was accompanied by a readily discernible decline in COVID-19 mortality in the state. So you can look at the source of this whole thing. I thought that I had broken this out to go through it, but it would be long. So check this out. It's very interesting data. I've talked about how the PCR test is not valid for diagnostic purposes. I've talked about how the inventor of the PCR test says it's not valid for diagnostic purposes. I've talked about how the WHO says these CT thresholds, the cycle thresholds, are too high to be accurately checking for positive results without other checks and balances in place. And we're locking people down and destroying their businesses based on these faulty tests. I don't know what it's going to take. Here's an interesting idea for passive income. Yes, welcome to my course. No, not really. But this is an idea for passive resistance, passive show of solidarity. It's to get a little smiley face and put it on your coat or maybe on your mask. Basically saying not wearing a mask is uncomfortable and could, like, you might not be seeing a friendly person who's like somebody who agrees with you about the masks or about the personal freedom laws. You might just be seeing somebody who's got a reason for not wearing a mask. But if you have a smiley face on, you could be supporting the idea of freedom. So the smiley face could be an idea to put on your clothes when you go out to show solidarity. A yellow smiley face, just like this, but any version would do. Just like that. I don't know. Any version would do. I think it's a good idea. I think that you need to have a way to show solidarity. But you know what happens then? It's just like a target. And that's unfortunate. Lockdowns. This is Rethinking Lockdowns. In the new MLI commentary titled Rethinking Lockdowns, the Risks and Trade-Offs of Public Health Measures to Prevent COVID-19 Infections, Dr. Ari Joff, a specialist in pediatrics and pediatric infectious disease, examines both the efficacy and cost of lockdowns measures employed in Canada and globally in early 2020. He finds that based on the most recent empirical data, the cost of lockdown measures widely exceeds their benefits. I was initially an initial proponent of lockdowns, explains Dr. Joff. However, as better information emerged, he re-examined the efficacy of such programs and found them harder to justify. In particular, as the pandemic has progressed, sometimes societies have found that the infection fatality rate is lower than was initially feared when lockdown measures were first implemented. Dr. Joff also notes that there is a much better understanding of who's at risk, arguing that less than 10% of the population is at high risk, accounting for more than 90% of potential deaths from COVID-19. Furthermore, lockdowns were generally an emergency measure implemented with little in the way of meaningful exit strategy, at least beyond simply waiting for an effective vaccine. The resurgence of cases throughout much of the world and the return to lockdowns in various jurisdictions points to some of the drawbacks associated with the over-reliance of such non-pharmaceutical interventions. Lockdowns have also resulted in a wide range of unintended ramifications, economic damage, delays in non-urgent surgery, diagnosis and treatments, and excess deaths arising from the collateral effects of lockdown measures should all be considered as policymakers weigh further measures. Dr. Joff argues that Canadians have been essentially presented with a false dichotomy between a choice of either economically damaging lockdowns or lethal inaction. However, his analysis finds that the cost of the lockdown measures compared poorly against their purported benefits when measured by quarterly adjusted life years or quarterly adjusted life years, or QALY. Various cost benefits analysis from different countries, including some of those costs, have consistently estimated these costs in lives from the lockdowns to be at least 5 to 10 times higher than the benefits, and likely far higher, writes Dr. Joff. Instead of resorting to lockdowns, policymakers must better balance priorities while still protecting the most vulnerable to the virus. Some recommendations for recalibrated response include better public education on the cost-benefit analysis of conducting lockdowns, and ensure that future consideration of lockdowns factor in more than just COVID-19 case numbers. Ha! Ha! I mean, good luck! If you can get them to talk about anything but case numbers, please, or ICU, they talk about inflated case numbers, and then they say the hospitals are at capacity. But any reasoning, there's only 900 people who have this across the entire province, and 500 odd hospitals. So, I mean, like, just the math of it, like, what? How can this possibly cripple us? How could it possibly be worth closing all small businesses? If it's safe to go to Walmart, it's safe to go to Joe's hardware store. Back to this. Keeping schools open due to low morbidity and transmission risks associated with children. It kills less children than the flu, COVID does. Focused restrictions and protection measures on high-risk populations. They've never done this anyway. They were setting up COVID red zones in long-term care facilities. Why? I don't know. They want to maximize deaths, I guess. Why did Governor Cuomo do the same thing? Improve surge capacity in healthcare settings if real-time data suggests need. Yeah, it would make sense that if you see, you know, it looks here like we're going to have this big surge and we're going to need to have a lot of people in the hospital and whatever, hire people, right? Say we will spare no expense, hire people. We have to keep our economy open. Instead, you're locking people in their houses? Like, this is just, I'm very long today. This is an unbelievable assault on our rights and our freedoms, and they don't even seem to care, and they don't care, right? Here's Jim Watson, and he says, my response to the government of Ontario's announcement of a 28-day lockdown in Ottawa, and he says it's right here, he doesn't agree with it. I'm going to read some of it, I guess. He says, today's provincial announcement has completely blindsided Ottawa residents and small businesses who have been diligently following the rules for months. The province sets the rules, we follow them, and they move the goalpost. We follow the new rules, and then they change them again. Despite the fact that we have the best numbers of any large Canadian city, we are now facing a 28-day lockdown that will likely have a devastating impact on our local economy. When asked about this potential lockdown on Friday, Ottawa Public Health was not in support, as they did not think it was necessary at this time. Dr. Etches has always supported a balanced approach to controlling COVID-19 in our community, and she believes we are on that balanced path in Ottawa. So yeah, I mean, there are leaders who are saying the same thing. Not my local leaders. I've asked them. They're not doing anything. They don't care. This is the CT threshold. This is the breakdown. Talking about the CT. This is worth it. I'm not going to go through it. I'm already really long, and I've still got a couple of big stories to go through. Here's one. Here's the city of Calgary just shut down our outdoor rink and our yard thanks to the neighbor who took photos of us playing hockey. Hockey is illegal in Canada. I asked the Guelph police if this would be illegal in Guelph as well. I haven't received a response yet. I'm still locked out of the public health unit's Twitter. Keenan Beck says, what does the world come to? Nenchi's henchmen went to Rod's house and shut down an ice rink they created in memory of their late child who was tragically killed in a triple homicide right out of kindergarten. That sentence makes me feel sick to my stomach. You know, when your stomach just drops. That is, I can't imagine what this family is going through, and then to have this bullshit, I couldn't imagine. I couldn't imagine at all. Here's a police officer. I've said, if you're a police officer, and I want proof, you don't have to prove to anybody else. Just prove to me that you're a police officer, and you and I can have a talk. But this is interesting. I wonder how many police feel this way. This is dated yesterday, December 21st. I'm a police officer and know many other officers in support of the following message. After the unfortunate events in Calgary, the time for action is now. I have serious concerns over Premier Ford's decision to expand further restrictions that put law enforcement officers in an untenable situation that must be avoided. For 10 months, public officials and bureaucrats have been operating with arbitrary emergency powers that often violate the fundamental freedoms guaranteed by the Charter of Rights and Freedoms. Every day, Premier Ford, Mayor Tory, and politically appointed bureaucrats are on television, radio, and in the newspapers calling on Ontarians to slowly allow all civil liberties to be taken away. What I have seldom seen in any comment by those in position of law enforcement and the judicial system addressing the lawfulness of these measures or on the grave consequences that they create. I'm calling on the following stakeholders to immediately meet independently from politicians and bureaucrats: the Ontario Chiefs of Police, police associations, members of the Ministry of the Attorney General, including Crown attorneys, justices of the peace, and constitutional lawyers. Please collaborate and deliver clear and concise direction to the men and women in law enforcement. Until this happens, a moratorium needs to be declared on the enforcement of public health orders by peace officers. 10 months has been far too long for this not to have happened. Are police officers supposed to uphold the Charter, which they have taken an oath to protect, or do municipal bylaws not supersede the Constitution, or now supersede the Constitution? At a time when the public trust in police has nearly eroded beyond repair, this is of paramount importance. The citizens of Ontario deserve transparency from their officials they have elected, as well as from the police that are sworn to serve and protect. This is not an unreasonable request. What happened in Calgary cannot happen again. Never in my life did I think I would see police officers threatening to taser and arrest kids playing pond hockey. It's terrible. Court dismisses, and I mean, I have a lot to say about that, but I'm hopeful that a police officer will get in touch. You can, if you want to email me on Proton Mail, you can find that contact information on CanadaPoly.com. It's just CanadaPoly@ProtonMail.com. And if you want to email me through my websites, etc., you can, Canada Report or CanadaPoly.com. CanadaReport.co, CanadaPoly.com. Check it out. Get in touch. I'm interested in talking with you. What do you think? I'm not sure. There's a lot to say on that. That's a whole show, and I'm already like, oh man, I'm so long. So long. Court dismisses Hudson Bay's application for review of Ontario lockdown rules. I don't know how they can dismiss this. It's just, I don't think they're, I was saying that they're going to not let us have our day in court, and it seems like they're not trying to rule on the constitutionality of it. So this, I don't know. I don't know that my commentary on this will be worthwhile. I'm not a lawyer. I don't know what I can add to this other than I feel like what is happening is completely not fair, not in the spirit of our judicial system. Okay, here it is. A legal challenge launched by Hudson Bay Company, ULC, in a bid to ease Ontario's retail lockdown measures has been struck down. On Friday, a panel of Ontario Superior Court judges, denied HBC's application for a judicial review. See, they denied the application, so they didn't actually make the review, in my opinion. I don't know, but they said that. Okay, so they denied the application, but that might be the review. I don't know. I don't think it is, but it might be. Okay. They denied an application for judicial review and mandated restrictions on non-essential retail in some regions of the province. The decision came after a hearing into the matter on Thursday, as Canada's oldest retailer attempted to salvage some in-store sales during the all-important holiday shopping season. A judicial review is a procedure whereby courts can review whether government decisions are reasonable. HBC had called on Ontario's rules irrational, arbitrary, and devoid of logic and consistency. They are. But during Thursday's hearing, a lawyer for the province argued that while the lockdowns are unfortunate for business, they're necessary to minimize risk. Liar. Fairness is not the test of this application. Indeed, there's a lot that's not fair in this pandemic, where Richard Ogden said, but we must not give into pandemic fatigue. We must hold the line. More BS Orwellian talk. This is propaganda. Back to this. The court dismissed HBC's application on Friday. In a statement, HBC spokesperson Tiffany Boer said the company is disappointed and will consider an appeal. The government's decision-making regarding non-essential retail continues to be harmful from both a health and economic perspective. We will continue to advocate for fair and evidence-based policy for all retailers, the statement said. Nico Vasavis, a spokesperson for Ontario Attorney General Doug Downey, confirmed the decision in a statement Friday and said that it would be inappropriate to comment further on the matter that is still before the courts and is subject to appeal. Wild, right? Here's a judge dismisses application to have some of Alberta's COVID-19 restrictions suspended. An attempt to have some of Alberta's government's COVID-19 restrictions temporarily suspended was rejected by a judge in Calgary on Monday afternoon. The court challenge presented by Rath and Company barristers and solicitors retained by Freedom Corp and the Justice for Constitutional Freedom, has been seeking a temporary suspension of some of the health measures in which it calls an attempt to save Christmas. Justice Ann Kirker dismissed the group's application for interlocutory injunction to temporarily suspend some public health measures. I wasn't satisfied that the balance of inconvenience favors granting an interlocutory injunction. I've probably said that wrong. Excuse me. Alberta is currently under a second state of public health emergency. The most recent set of public health measures restrict both indoor and outdoor social gatherings, and all dine-in services at restaurants and bars. A 15% capacity limit has also been imposed on retail services. The group seeking to have some restrictions suspended alleged the restrictions are incarcerating 4.5 million Albertans in their homes for Christmas without evidence to justify the orders. The group accused the government of bankrupting businesses and stripping citizens of Alberta of most of their rights under the Alberta Bill of Rights and the Charter of Rights and Freedoms with arbitrary health orders. The new health orders were imposed in response to days of ever-increasing COVID-19 infections, hospitalizations, ICU admissions, and deaths in the province, with Premier Jason Kenney saying it was imperative the province protect Albertans as well as the healthcare system. If stronger actions is not taken now, we know that hundreds of, or potentially thousands of Albertans could die, says Jason Kenney on December 8th. How many have died since December 8th? In court Monday, Justice Center for Constitutional Freedom's lawyer James Kitchen submitted that the affidavit provided by Dr. Dina Henshaw was hypothetical and speculative. He also argued that taking Christmas away from Albertans will have devastating effects on mental health of citizens that would cause irreparable harm not being able to celebrate Christmas. Christmas would be a traumatic memory, particularly for a grandparent where this may be their last Christmas. Calgary lawyer Jeffrey Rath, who also acted as a lawyer for one of the respondents, presented to Kicker that Christmas has been taken away from the government without any proof that Christmas would in fact create the harm that they're alleging. Parker said that the suggestion that we're not in a pandemic is an alternate version of facts, and added that it's important to not obfuscate the message and the importance of following orders. I think that it's interesting. They didn't even address any of the real problems, like the unconstitutionality of the whole thing, et cetera, et cetera, et cetera. It's just wild. The judge said the applicants have established with their evidence the benefit of allowing citizens of this province to gather and celebrate the holidays and to otherwise exercise unconstrained their religious freedoms. I hear and appreciate how difficult it is for the applicants and other members of the public, especially at this time of year, but I cannot find the public interest is served in granting this stay, she said. I must assume the restrictions protect the public health. The government has repeatedly said evidence points to social gatherings as the largest source of transmission in the province. So I said months ago that, they can't stop people from coming to your house, but they can put the fear of God into people for coming to your house, and they can fine people for skating on hockey rinks, et cetera, et cetera, et cetera. What they're doing is sick. These people are abusing us. They're abusing the population. It is sick. I scroll down a bit. As part of the challenge, the lawyers presented evidence to the court that suggests American treatments that have significantly reduced COVID-19's mortality rate have been ignored by Alberta Health Services. In Verdicin, the I1, HCQ, all sorts of treatments have been used and worked. Anyway, it now falls to the courts to decide if one unelected doctor can prevent millions of healthy Albertans who are almost no risk of COVID-19 from deciding for themselves whether to celebrate Christmas with their families in their own homes. Justice Centre lawyer James Kitchen. Sad state of affairs. Here's the Justice Centre's press release. Here's the UK's death rates per 100,000. I talked about that already. I think this is worthwhile, but man, we're so long already. We're so long that it might not even matter. Cargill is on this group. Okay, this is Trump's attorney. He says an analysis of CCP's intentions without potential for COVID-19. In December of 2000, this is a whole thing. Hold on, let me see. I'll just highlight the important thing here. Chicom has, through Chinese companies, been buying out agricultural, farming, and livestock companies in the United States and Canada over the last several decades. It's estimated that as much as 30 million acres of arable farmland in the United States may be owned entirely by the CCP through proxy and shell companies. This is a partial list of the United States companies critical to the nation's food supply chain that are currently owned or controlled by Chinese companies. Cargill's, I was talking about the Cargill shutdown the other day. Other ones are Growmark, Tyson Foods, Smithville Farms, Tyson Fresh Farms, JBS Pork Processing. There's some concerning. This is all in line with Project Sidewinder, with the things that we've known since 1997. The report ends with IAP intelligence concludes that this is a clear and present danger to the United States of America, its citizens, and its interests as a whole. So yeah, I mean, problems. There's lots of problems. This talks about COVID-19 and ties it all together. I wish I had more time, or I wish I could shrink down the amount of time that it takes. Anyway, it doesn't matter. Canada rejects Shandong's Gold's bid to buy Arctic mine over national security. I mean, it's laughable, right? They'll just buy a company that's going to buy it as pretend they're Canadians. Here's Dr. Thomas Binder. I used this before, but this is the the raw data from his Twitter, from the CDC report and linked. It says, I've never seen serious side effects from the flu shot within days after the application of the Pfizer-BioNTech mRNA transfection. 2.9% were unable to perform normal daily activities, unable to work, or required care from a doctor or healthcare professional. That's a massive number. That's a massive number. I can't imagine people lining up for this. There's more information on the Nova Scotia gunman. He had 6 properties listed under his name, thousands in cash on hand. He seems pretty well set up. Mass COVID-19 testing of students returns just 13 positives after 44,000 tests in Scotland. Yet we're closing schools in Toronto for doing PCR tests. So they do a 2-stage test. They do a surface test, like to gather potential positives, and then from the potential positives, then they give them another test. And I think the second test is the PCR test. So, this whole thing just seems like a scam. It seems like a scam, a sham. And I am sick and tired of being scammed. I'm sick and tired of being experimented on. I'm sick and tired of being locked down like a criminal. I'm sick and tired of being treated like I'm sick. I'm sick and tired of everybody else believing the bullshit. I couldn't imagine walking around after 9/11 and like Building 7 didn't collapse itself and nothing flew into it. So what happened there? And then living through the last 4 years of Trump and still having to wait. My goodness, I don't know what's going to happen. I don't know if anything's going to happen, but it seems like all of the governments of the world, Canada, Australia, United Kingdom, Western governments of the world, state governors, they're all lining up to gaslight their citizens into pretending that they're sick. They're forcing closures. And this all lines up with this document, the Chinese document. It says, hold on, at the beginning, it says, in December 2005, Comrade General Qi, vice chairman of China's military commission, spoke of China's intention to expand well beyond its own borders. General Qi indicated strongly that China's long-term goal is solving the issue of America by using non-destructive weapons to kill many people, thereby enabling China to reserve America for itself. General Qi said further that China, with that view, his focus is on developing lethal weapons that can eliminate mass populations of the enemy country. Lethal weapons like starvation, the Holodomor was a thing. So when you tie all of this up, when you understand that when you understand Go, the board game Go and how that works, when you understand that the Chinese expansion uses Go as a strategy and uses people as its tools, uses relationships as its tools, has friendships built with doctors, has relationships built with politicians, has all the way up to the Vice President of the United States, Joe Biden, in its trap. And you see that they control the food, and you see that they're trying for expansion and to remove mass amounts of other population with non-lethal weapons. So, breed them out or starve them or what? I don't know what it is. But it all seems like it's lining up, like all those planets lined up yesterday. It all seems like it's lining up. And it seems like we got to jump one way or another. The train's coming, and we've got to jump one way or the other, or we're just going to get flattened. Feels like we're in a vice. Yep. So that's where we're at. I don't know what's going to happen next. Man, this is a long show. Sorry. At 45 minutes, I was like, well, I'll just finish, I guess. I don't know. I don't know what's going to happen. I don't know why we can't seem to hold our elected officials accountable. I don't know why the courts. I do know why these things are happening. I do understand why we can't hold our elected officials. I do understand why the courts aren't siding with patriotic people. And all of that lines back to this. All of that comes back to this. All of that comes back to China's expansion, China's relationships, China's ability to make inroads in the West, and the West's inability to even realize what's happening to us because we're so arrogant. We're so arrogant. Somebody must have said somewhere, do you think bombing the shit out of the Middle East in 2003 would have any consequences? Somebody must have said that. Welcome to the consequences. The consequences are the enemy's figured out how to infiltrate and how to slowly boil the frog to the point where we're not even capable of fighting back. We're not even capable of identifying the problem at this point in time in Canada. We're at a situation where we're funding the corruption. Here's $90 million. We hear you're out of money and you need some money for your terrorist activities. Canada's there. Don't worry. Goodness me, we're in a lot of trouble. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. I'll be recording with Greg today, and have a wonderful, wonderful day. Maybe I'll talk with Greg about the police thing.